name is Hunter, and today I'm going to be going over how to get an oral med pass. The first thing I'm going to do is I'm going to unlock the med room. It should always be locked. Now taking a look at my physician's order sheet and the medication administration record for this patient today, I'm going to compare them for any discrepancies. Right off the bat, I do see there is some discrepancies with the name. I have a dose of Cenflexin without a route that's not in the physician's order sheet. I have a multivitamin that doesn't have the dosage amount. So I'm going to call the doctor and I'm going to verify these discrepancies. Hi, Dr. Stevens. This is Hunter. I just wanted to confirm a few things about a patient's medication. Okay, thank you for letting me know. So you always want to confirm things when you don't know them. Never shy away from calling the prescriber. So now I'm assessing the patient's medications, allergies. I'm looking at his medical history. I just want to know if there's any contraindications I should, be thinking of when I administer these drugs. And if there's any hazards, if there's any reasons I shouldn't get these drugs. So I am a new nurse, and as a new nurse or even an old nurse, if you're not sure about a medication you're administering, never be afraid to research it. So Metoprolol is one of the medications Mr. Smith has been prescribed, and it is a beta blocker. You can give it 50 to 400 milligrams per day. The onset is 1 hour. The peak is 2 to 4 hours, and the duration can be 10 to 20 hours. This is a high alert drug, so that's important for me to know. I have to take the apical pulse for 1 full minute. I need to take his blood pressure in a supine and standing position. I need to record his weight because I'm checking for edema. Next here I have Cenflexin. It's a first generation cephalosporin and it's related to penicillin. This drug, it peaks within 1 hour. The onset is variable and the duration is 6 to 12 hours. I can't prescribe. I can give a dose of 250 milligrams every 6 hours. It works well on gram-positive bacteria, and there are some adverse effects. Adverse effects is mild diarrhea, cramps, rash, redness, and edema. Last but not least, I have warfarin. This is an anticoagulant. I need to make sure I'm monitoring the prothrombin levels, and a therapeutic level is going to be between 2 and 3.5. The onset of this drug is 24 to 72 hours. It peaks within 4 hours, and the duration can be from 2 to 5 days. I am knowledgeable on the multivitamin, and I know that it is safe with the rest of these drugs as well. The only thing that made me a little hesitant is that warfarin shouldn't be given with antibiotics, and I know that the Cenflexin is an antibiotic, so I'm just going to call Dr. Stevens and make sure that that is safe. Hi, Dr. Stevens. I just had a quick question about warfarin. Okay, cool. And it can be given with Cenflexin. It just can't be given with sulfonamide antibiotics. Perfect. Thank you for letting me know. Alrighty, so checking the time of this med pass is going to be at 9 o'clock. It's 8:30 right now, so I have plenty of time to prepare this medication. First, I'm going to wash my hands and put on gloves. You don't want to touch the medication ever directly. You don't want to touch the inside lids of your medication or the inside of the bottles. This prevents contamination. I want to do 1 dose at a time. I'm putting out 1 drug at a time. Taking off the cap, putting it on its back, and putting each dose in at a time, and then placing it in a med cup. So here I have my warfarin, I have my Metoprolol and my multivitamin. I'm going to put it here on my med tray. And for my Cenflexin, it is a liquid dose, so I want to go eye level when pouring, and I want to measure from the meniscus, drying all excess on the outside of my bottle. Alrighty, disposing my PPE. And taking my med. So on my med tray, I have both doses, and I also have a granola bar just because these medications, they can be given before, after, or during with food, and because some of the adverse effects involve the stomach, upset stomach, I do want to offer him food and just make that available to him. So before entering this patient's room, I want to remind myself of the 6 administration rights. And I want to remind myself I need to take this patient's weight, their blood pressure, their apical pulse, and their prothrombin levels. Knocking, so I give him a heads up. Hi, Mr. Smith. It's Hunter. I'm here with your medications today. How are you? Wonderful. Now, Sam, can you please just let me know your date of birth and your name for me, your full name?
My name is Sam Smith. I was born on December 5th, 1988.
Thank you, Sam. Do you mind if I just take a look at your wristband here and scan it? Scan. Perfect. Thank you so much. Now, Sam, today I need to take your apical pulse, your blood pressure, all that jazz. Did all that jazz. Now, I wanted to let you know that I am going to be giving you a beta blocker today, an antibiotic, and your anticoagulants today, and a multivitamin. There is some adverse effects, so you could experience some diarrhea, some abdominal cramping. This is known with the medication, so just let me know if you're having any problems, and I'd be happy to try to assist you. Have you ever had any problems with dysphagia or aspiration?
No.
All right, I just wanted to make sure. And how do you prefer to take your medication? All at once? Okay, so I'm gonna make sure my patient is sitting up just because it does prevent aspiration or any dysphagia. So my patient's gonna just take their medication with water. Good job, Sam. And I do want to make sure that he has taken all his medication. He does have the right to refuse, so any medication he refused today, I would just have to document that today in the MAR. So I have confirmed with him, he has taken his medication, he's all right. I have finished my post-procedural steps. He did want the food. All right, there you go, Sam, lovely. Now I'm gonna exit the room, and I'm immediately gonna document the medication administration.